Welcome to The Healthline, issues that shape our well-being. I'm your host, Dr. Andrea Ault-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. Today, I'm very excited to have Bernard Robinson on The Healthline. Bernard Robinson has over 3 decades of experience in healthcare leadership. He embarked on his healthcare career as an emergency medical technician with FDNY in Brooklyn, New York. Before coming to Hofstra, he was the director of EMS operations with Northwell Health and associate director of Kings County Hospital with New York City Health and Hospitals Corporation. He is now at Hofstra, where he is a special instructor and director of the Hofstra University Health Informatics Master's Program. At Hofstra, Bernard mentors students and works with the faculty to build a premier program. Bernard, welcome to The Healthline. Very excited to have you on the podcast.
Thank you. Glad to be here.
Thank you. So can you tell us a little bit more about yourself and what sparked your interest in healthcare?
My journey in healthcare started probably, I would say, when I was born, simply because my father was an EMS. He was a retired EMS lieutenant. Once I came out of high school, I had no choice. He threw me right in the EMT school. Like, well, you're not going to just, bum around here all summer. You're going to do something with yourself. And that was my entrance into healthcare. I went kicking and screaming because I wanted nothing to do with blood or anything of that nature, but it turned out I actually fell in love with the job. I always say that was the best job I had, was working in EMS. I did that through my college years, so it was also a great way to make money and learn more about myself and how I could handle stressful situations. And I just continued to just grow and grow as a person and as a professional in that field. As you kind of read through different positions throughout the career, it kind of just grew and grew.
Great. So can you tell us more about your past leadership experience and why improving healthcare leadership is important to you?
So past leadership, my original leadership experience actually came through the church. I was growing in the church and in different leadership positions, and that's where I got my initial early onset leadership training. And I then started to apply those principles that I learned to work. And then my career started to grow. Leadership principles transfer no matter what arena you're in. Whether you're in a church and you're leading people, or you're leading them in the healthcare field or whatever field, the principles are the same. They started to work. I started growing. The career grew. I leapfrogged a couple of bosses and kind of just learned that, yes, these are important. And as far as applying it in healthcare is always changing. The industry continues to change. And if the leadership does not change with it, either going to get bypassed or just blown away as an organization. That's what you do not want to happen. So leadership must stay current. It must be flexible. It must be open-minded. Leadership must be willing to take those risks. And you also have to be willing to deal with uncertainty. In healthcare, we deal with a lot of uncertainty, whether it's a pandemic, whether it's a hurricane that's coming, whatever it is, that's something that's going to disrupt the normal patterns of a life. You have to be able to adjust, adapt, and overcome. I think that's a military term, but it's one of my favorites also, that you have to do that. With leadership in healthcare or anywhere, John Maxwell, he says everything rises and falls on leadership, and that's very true. You can attribute how well an organization performs because of the leadership, or how they're failing in a certain area is because of something that's going on with the leadership. So leadership is critical with healthcare.
You mentioned uncertainty, and we are definitely in uncertain times. So that made a great point. Thank you. So you are about to complete your doctorate in strategic leadership, right?
Yes,
Congratulations in advance.
Thank you.
And you are examining the importance of health equity as a focus of strategic leadership. And in fact, eliminating disparities in healthcare is one of your passions. So can you tell us more about your research and your passion for eliminating healthcare disparities?
So, yes, I'm wrapping up my doctorate any day now. So my final doctoral project, the title is A Strategic Plan for Black Health Equity, Transforming Systems to Eliminate Disparities. And what that is, it's a lot of research that was done into how disparities have affected the Black community, but also how those disparities are going to affect the healthcare system, and ultimately it's going to overlap into every other system. The research, I looked at why is that passionate for me? Because one, as a Black man, I hear all the time how bad our health is, how our life expectancy is 7 years shorter than white males, or how Black women are dying at a faster rate than white women giving childbirth. We have the highest rate for cancers. We can go on and on about the disparities through the stats, but we never talked about why and how do we get here? Why is it like this? So in the research, I go back to the history of how disparities started. And to be honest, it's honestly as simple as a black and white thing, right? There was slavery in America. They weren't afforded health care, obviously. And then we went into Jim Crow. They weren't afforded health care. And then came legal segregation, weren't afforded health care. So there's about a almost 400-year head start of white people in America having access to health care before Black people even got access to health care. So with that, those attitudes, those we'll call it biases and other harsh words for it, transferred over the years. So then you have stories of Black people being experimented on, whether it's Tuskegee, whether it's the Marion Sims, the father of gynecology, who experimented surgical techniques on Black women without anesthesia, just because in the name of medicine, and these kind of practices. This is why we're here. This is how we got here, and these are the results of that. So how do we fix that? You have to go way back into where it started and fix the foundation of it. Otherwise, anything with a shaky foundation is never going to grow into something healthy. A building with a bad foundation will eventually fall over, right? And if the health disparities continue financially, it will collapse this healthcare system, which will then collapse the other the financial system, and other systems will collapse. We're talking about probably almost $1 trillion a year is what health disparities are costing. Just the disparities because of the unequal health situation. So yes, something needs to be done. And again, as a Black man, this really affects me because when I see those reports, they're talking to me, but they're not giving me how do we fix it.
Yeah. So how do we fix it? In your dissertation, I don't know if you've solved that problem yet, but you do see healthcare leadership playing a role. So what are you seeing in your research to have healthcare leadership address healthcare disparities?
Honestly, it's not a blanket approach. So what I did in my work is I wrote out a plan for different sectors of society to take their part. So there's a plan written out for the government sector and what they can do. There's a plan written out for the education sector, which comes with what are we teaching in the medical schools to address that. It has to be more than just a checkbox approach. Hey, we checked this box. We offered this class on implicit bias, so now we can put all of our doctors out there because they won't do it. That's not the way it goes. This has to be an ongoing thing that must start from early childhood education to root out those biases that may be there from past practices. So yes, we address the community itself, right? I have to address, because yes, we suffer from disparities, but we also have a part to play in getting out of it. And I know that we all know there is a lack of trust that the Black community has towards the healthcare industry, healthcare system, and rightfully so, given the past histories. But there's also in this a strategy to fix that. And a big part of that strategy is utilizing the relationship with the faith-based community in the church. I talk a lot about that because I believe that's an untapped ally that can benefit this fight as far as changing attitudes towards healthcare, which is what we, as a healthcare industry, we need to do. Also, remember my point of view. I'm coming from someone who works as a representative of healthcare, but also as someone who receives the bad part of these disparities, right? So I'm kind of like on both sides here, and I'm trying to figure out a solution that will be amicable and fix the problem.
That's great. And I love how you are thinking about it with a social determinants of health framework.
Yes.
And also thinking about the strength within faith-based organizations and also the strength within communities. So that's great. And you have other passions. And so you are here at Hofstra
Yes.
as the director of Health Informatics Master's Program. So for our audience who are not familiar with the term, can you tell us more about health informatics?
The main question I get if I tell people, hey, I'm the director of the health informatics program at Hofstra, there's one or two responses. Usually they'll go, oh, that's awesome. And then also, well, what is health informatics, right? That's the big question. What health informatics is, it's where healthcare, technology, computer science, data all collide into one space. And what we do in the health informatics field is take all of that information, utilize it to make better decisions that will lead to better patient outcomes, that will lead to more efficient running of operations, that will lead to better quality and even precise treatments. So that's like in a nutshell what it is. Now, health informatics is kind of like the umbrella name, because then you hear HIT, health IT, health tech, a lot
AI,
of AI,
yeah.
machine learning. All of those fall under the health informatics umbrella.
Okay.
Health informatics is the fastest growing segment in healthcare, and that's largely due to the explosion of data, electronic medical records, all huge
data.
things right now that are happening in healthcare. It's like I said, it's probably the fastest growing sector in healthcare. I realized as I teach it and as I started working here that it's been a part of my life throughout my healthcare career. I just didn't know what the name of it was. When I was director for EMS at my former place of employment, we used to use it, predictive analytics, to determine where we should send resources, because we knew that because of the data we had, we could predict where call volume would be and where was most likely that the next emergency would be and we'd have to go. So we would already pre-plan based on that data. So that's just one form of like predictive analytics and using that. And I really appreciated health informatics. I have over 30 years in healthcare, and a lot of reports I used to run manually. Now there's programs that do it in 5 seconds. I can run the same report that took me a week and a half to manually. So that's also health informatics, is simplifying and kind of taking away those tasks that was so meticulous for us and heavy. But now it just makes that part of it much easier as well. So yes, health informatics is welcome. It's here to stay, and it's growing and growing and growing.
So now, bringing in your passion for eliminating healthcare disparities, how do you see health informatics playing a role in that?
So, great question and very relevant. So with health informatics, we have a lot of, AI is one of on the horizon. It's here, but it's definitely another growing part of its influence in healthcare. And with AI, there's a lot of reports and literature that speaks of bias in AI, which is another thing that puzzled me, because it's, how can a machine be biased, right? And it goes back to the root: who's programming them, who's and even a few months back, New York City, and this is where it first struck me, New York City started utilizing face recognition technology, and then they found that was bias towards people with darker skin tones, and they were the ones getting flagged more than everybody else. And it's, how does that happen? How does a machine know? So yes, that once again, that's where the research comes in, and the implementation of guardrails to prevent that kind of bias from infiltrating into AI, because that will ultimately affect how it diagnoses, how it reads, test results, which will alter the output and alter the patient care of specific communities.
Great, thank you. And so now, with you as the new director of the Health Informatics Master Program, what major goals do you have for the program, and what events, if any, do you have on the horizon with the program?
With the program, we call it the MHI program. One of the first things we did, now realize this is my first year. This is my first year here at Hofstra as faculty. I am a Hofstra alum. I probably should have said this in the beginning, but I am an MHA alum. And I loved my experience here at Hofstra, was incredible. So I loved it, which is kind of why I guess I ended up back here. And this is my first year as a program director, as faculty. Teaching has been a part of me forever, and mentoring has always been, just who I was. So it was a natural fit. Now, with this program, the first thing I wanted to do was establish what the program is, who we are as a program. So we changed the name, right? So it's the MHI program, right? Health Informatics program. Because when I first got here, if I spoke to 4 different people, they called the program 4 different things. It was, it's the HIT program, it's the MHI, it's the MSHI. It's the MHI program. Let's establish who we are, and now let's build out from there. So with the curriculum, we made a couple of changes. We've added some AI machine learning course. The information, the curriculum, we have to keep an eye on it because with health informatics, with data, anytime you're dealing with technology, what was new 2 years ago is probably outdated. So, and that goes the same with the curriculum. So I always have to keep an eye on that and for trends and where we're going to make sure that the students are getting the best experience they can and that they are ready from when they graduate from here to, jump right in and be leaders in their field of choice. When it comes to other changes, we just made some big changes with the program is as of the fall, this coming fall, will be a 36 credit program, whereas previously it was a 41 credit program. So that's a big change approved through New York State and all the proper channels. So we're excited about that, which kind of brings us on par with the industry standard, if you will. We've brought on 3 new faculty members. And my big thing with this program is we got to have the best faculty. I'm trying to put together the best team because no one's coming to this program because of me, but they're going to come because of who's teaching them. And I make sure we bring in the best instructors that are leaders in the field, that are power players in the field. And I have professors that are doing some incredible things outside of Hofstra, which translate into the classroom. I'm really hearing great things from the students taking those classes, which is really exciting. I'm expanding our educational affiliates so that a big part of our program is that our students are required to do mandatory practicum courses, meaning that they'll have to do like internship hours for 2 semesters. I'm adding on more and more partners, which are giving more and more opportunities and, a more diverse network of places where they have opportunities to work, which is great. And I've gotten great positive results. We've brought on Episcopal Health Services just joined us, Start Care New York, which is a nonprofit in the 5 boroughs, doing great work. Harmony Health. There's about 5 new partnerships we've brought on since I've started, which is great.
But what do you have coming up? I know that National Public Health Week is coming up, so...
Right, so National Public Health Week is on the horizon. It's coming in April, and that's more on the MHA side of me, my health administration side. But we do have a panel discussion with some CEOs to talk about the issue of bias and healthcare equity. And a good talk about that is coming up. And we have some social events as well, because networking, and I tell this to my students all the time, networking is a big part of who you're going to be, and it has to be a part of what you do. So there are going to be a lot of networking opportunities. And also, what I'm incorporating into the program and into the classroom is soft skills training, because you'll find it's easy to say, take your resume and go talk to these people, but unless you know how to present yourself, you're going to be, caught off guard. So I'm trying to make sure that when they leave here, they are very well prepared, classroom ready and socially ready to, take the world by storm.
Great. You mentioned already that you are an alum of the MHA program. Mm-hmm. What is it that you loved so much about the MHA program?
So the MHA program, this is a true story. I came to the open house. And there were other programs there. And so I went to one program and I tried to ask a question and I got a cold response. And that kind of was like, didn't sit well with me. And immediately I turned and it was Professor Edward Caulfield. And if you know Dr. Caulfield, they drew me right in, right? So I went to sit in on the session and I sat down, and in front of me was Walter Markowitz, Dr. Markowitz. He just turned around, stuck out his hand, introduced himself, and he and I have been like pretty much best friends since that day. I even took 3 of his classes, part of my coursework. It was just the way that program just drew me in. It was no questions asked. I basically didn't even have to reach out to them. They kind of drew me in. And from that instant connection, that relationship was formed. And I went through the program, and that program changed my life. And I tell students, your bachelor's is good, but the master's degree, for me, it definitely was the game changer for me. And once I achieved that degree, doors really opened up and things just kind of took off in a different way than before. So I always recommend, continue that education. Master's degree, definitely. MHA, sure. But now since I'm health informatics, come this way, let's change the world.
Amazing. So thank you so much for being a guest today on our show, The Health Line. Any parting words before we wrap up, actually?
You know, we're all going to have different obstacles in our way as we go through our journey, but it's important that you stay focused on what your goal is. You don't get distracted, and you just keep persevering no matter what. Just me sitting here is kind of a testimony to things happen suddenly that will change on you, and you just have to persevere and keep going. And even in the pursuit of this degree of the doctorate, there were things that happened through this process that any one of them would have rightfully, stopped me and said, hey, you can't do this, but you just got to keep pushing through. This is one of my proudest achievements, and also I'm very proud of the work I'm doing here at Hofstra, and I love being here. Everybody has been great from day one, and really made me feel welcome, and I love that, and I'm definitely growing professionally and personally just from the experience here. So I appreciate it, and thank you, Hofstra, and thank you to you for having me.
Oh, thank you. Well, thank you for those parting words, and thank you for just being here on The Health Line. Thank you for all the amazing work that you're doing with the master's program. So we're really happy to have you here. This is Dr. Andrea Ault-Brutus, and this is The Health Line, and we look forward to seeing you on the next episode.